Crystal Howells here with Expecting and Empowered. I wanted to talk to you guys a little bit about round ligament pain. For those of you that already have it, that are finding it, oh my gosh, these are helpful tips. So it can be very, very intense. The round ligament gives like a noticeable pain when you go from sit to stand motion. Sometimes when you're sneezing, any transitional movement, when you're rolling over in bed, these are the kind of times that it seems to bother women the most. So what we can do, number one is avoidance, and number two is kind of strengthening the muscles or prepping the muscles that put more stress on the round ligament. So the round ligament runs from the uterus to the inside of the pelvis. So women can experience it on one or both sides. If you're experiencing round ligament pain, when you get out of a chair, some helpful tips would be to kind of prep the tissue. What I would do to prep the tissue is, if my right side is painful, I'm gonna let my leg drop on the right, kind of stretching, almost like a hip flexor stretch, but I'm stretching that out. If I can feel a stretch already without doing anything, I'm kind of staying there and taking some deep breaths in and out to kind of let that relax, or I can try to pull my leg a little further back. And then if that is comfortable, you can try to push upright through the couch, like almost leaning up and over towards my opposite shoulder to stretch that round ligament out. Then what I would want to do is slowly come back into the position, so straight forward. But what I'm going to do is go nose or face over toes. So you might have to bring your legs a little bit wider when you're pregnant to accommodate for the belly. But then I'm going to push upright through the chair. I'm trying to use my arms and legs as much as I can, but I'm really leaning forward. And then it looks ridiculous, but getting up so slow because the round ligament does not like quick stretches. So that would be helpful tips for getting up. When you sneeze can also be a very painful time. So if you know you're gonna sneeze, I would lean forward, almost protecting that, like, feels like you're protecting that little baby. That takes some of the stretch off the ligament so that it's not so painful when you sneeze. The other thing that we talked about in the blog a little bit is round ligament massage. Now, this structure is very deep, and odds are you're probably not getting to the structure, but we can affect the superficial tissue, which is going to help affect that round ligament. So if we let go of some of the restrictions superficially, that should help create a nicer environment for the round ligament to live in. So again, our round ligament goes from the belly button to the side of the hip. So you could do this laying down, but I'm going to show you guys in standing just so you can see. But when I'm stretching, I want to go in this direction, kind of running the course of the ligament, and then I also can make small circles. So I can stretch by pulling apart my skin there, and then I'm just holding that, breathing into that at times, or otherwise I can pull this way and then also make small circles going towards the opposite side of your hip. Now, we're not going super aggressive with that, but we are trying to like deform the tissue a little bit. So if the pain persists though with rest, it's not round ligament pain, and then you definitely need to be seeing your OBGYN or asking your doctor about that. But those are some helpful tips, and hopefully that helps, because I know it is very intense for women that experience it.